Good morning. Let's be excited about this day, huh? All right. If all else fails in opening remarks, get people excited. So last year, I had the opportunity, my first time giving this talk, and I had only been here for about 3 months, and I was very focused on my talk, and I got 95% of the way done, and I thought to myself, you never introduced yourself, and if they don't have a program, they have no idea who you are. So I am Britt Cruz. I'm the Southern Region President, which includes Maine Medical Center for Maine Health, and I am very excited and honored to be here today. And I want to welcome everyone. I just want to, before I get into a lot of thanks, just want to talk about the class, the 2025 class that is graduating from our main track program. And the first thing is that you interviewed online, and anyone in the room that has interviewed online, that is a different experience, isn't it? You can shake your head saying, yeah, I don't want to do that again. You were welcomed virtually. I believe the McCusick lecture was done by Andy Mueller and our CEO of our organization. I believe a dozen of you are staying at Maine Medical Center. And yeah, we'll keep increasing that for years to come. But also that you really were a group that lived through a pandemic, and first and foremost, really one of the first classes to have to do that, and living online and virtually and alone. And so we're excited to have you, and we're excited that you persevered, and we're excited that you are here today. Um, a couple of thanks that I like to do. First of all, the students for choosing the main track program. It's really important to those of us in Maine. We're very excited about that. And I must admit that I got excited because I recognize some of your faces. That means you're walking around the halls at Maine Medical Center, and you're doing what you should be doing, probably going in to talk to patients. So wonderful. I'd like to thank parents, siblings, friends, loved ones. It takes a village, and you've done a great job. So congratulations to all of you. I'd like to thank our donors and the philanthropists who helped make this program a reality. A couple $1 million every year is donated so that the main track program can be a reality and can help those people in the state of Maine. So thank you to all of those that have been benefactors. And finally, I'll thank the faculty. We have some of them right here with us. They've done a great job. They've gotten you prepared. You're ready for the next thing called residency, and we're really excited about that. But thank you to the faculty. Appreciate it. So I was thinking about giving a nice PowerPoint presentation, but I thought no one would actually pay attention, that the students would be like, you got to be kidding me. I've seen enough of those in my time. So, but as I was thinking about something to say, I can't relate to what it's like to be a clinician because I'm not. I'm not a doctor. I'm not a nurse. I'm not a technologist, but I am a patient, and I have been since the age of 7 in the healthcare system. So I may look at things kind of from a patient-centered perspective. And as I was thinking about your next phase of your lives, I thought, what can I give them in 3 or 4 minutes that might actually be meaningful? And I thought about our values that we have at Maine Health. And the first value that we have is being patient-centered. And my recommendation is to always think that the patient is an N of 1. You may have a day that you have 68 patients on the floor that you have to go and see that particular morning. Every one of them considers themselves an N of 1. So you consider being patient-centered, focused on the person in front of you, focused on the family in front of you, because the only person they really care about in the hospital or in the clinic or wherever it may be at that time is the people in that room. The second one is respect. You're going to have an opportunity to work with a lot of different groups, and you're going to be the leader of those groups. You will have pharmacists, You will have nurses. You will have technologists. When you're frustrated that you don't have a lab at 3 a.m. and it's going to happen, the person that you're talking to will have they want to have some rapport with you. Just think through those things, and respect is so critical in what we do, and especially as the leader, because you are the leader of the healthcare team and that patient. When I think about the third one, integrity, be honest, be open. The families, again, if you tell them, I'll be back later on in the day, make it a high priority that you will be. It's hard. I know you're going to have so many things thrown at you, but integrity is so critical and honesty is so critical in what we do. Excellence in everything, be excellent. Provide great quality care, provide great safety when you are taking care of patients, but also think about the fact that the culture that you are as a leader, you are leading that culture. That work culture is critical because you don't want people to leave the organization wherever you are. Um, Also, just think about the fact that the patient experience, again, is all around what you are doing, and just be focused on that from an excellence standpoint. Ownership. Own what is going on with the patient. You know that you will do that, and I have no doubt that you will do that in excellence. And then finally, innovation. Never stop being curious. Always think about what can we do better. How can we do this better so that the patient is going to have a better experience and a better outcome. This program is innovation. The fact that we have this great relationship between Tufts and Maine Health, Maine Track program helps the people of Maine, helps the students, and it helps really helps uh, get us to a different level of healthcare here in the state of Maine. So those are the things that I would ask that you think about as you go into your next phase and the next journey of your careers. I couldn't be more excited for you. I happen to have that opportunity to see you get to open up your envelopes, and just the emotion of that day. I told Doug Sawyer I'd never been part of that, and I saw that excitement and that kind of overwhelming. Okay, this is next. It's here. It's finally. I've made it through this phase. So I just want to wish you won't need that, but just you're going to do great things for the group, for the people that you care for in going forward. So with that, I'd like to introduce Amy Kulik, our Dean of Student Affairs and Assistant Professor of Medicine with Tufts University School of Medicine. Thanks. Thank you.
Thank you. Good morning, Maine Track class of 2025. Give yourself a big hand. You deserve it. It's really an honor for me to be able to celebrate this milestone and all of your achievements with your families, with you, with your faculty. Some of you have coaches here as well, really with your village. So I feel really honored just to be here. I thought back last night to when you arrived. In 2021. We actually thought everybody was vaccinated. You know, this pandemic was certainly at a better point. And then with you, in swept, I think it was Delta. I think that was the prevailing strain at the time. And we all had to kind of go into pandemic mode. You were masked. We had virtual orientations. You weathered that time of uncertainty and challenge and really emerged as a class that will be remembered for your passion, for your advocacy, and for your commitment to excellence that Britt just mentioned. That's your class. And you also have a unique dedication to community that has been really special to see blossom from a time when we were kind of separated by the pandemic to a time when you all were able to come together and really create this incredible community. You're now leaving here and going out into the world amidst a new uncertainty, a challenge to science, to higher education, to funding of vital medical research, and a challenge to our efforts as a profession to improve health justice and equity for our patients. But I have no doubt watching you these past few years that you will meet these challenges with your characteristic resilience, creativity, and humility. So I have only a couple of pieces of unsolicited advice because I'm really up here to present your speaker, which I have the pleasure of doing in a minute. But the first, and you're going to hear some things that will resonate. The first is to approach your patients with curiosity. They all have led an incredible life, whether they're young children or whether and you're talking to their parents or talking to an older patient. Be curious about them and about their life, not just about their illness. Lead with the empathy that I've seen so characteristic of all of you. And probably the most important thing is to ask for help when you need it. We all need help. This is a profession, we're a team sport, and you will need help. And please make sure to ask for help. It's a sign of strength. Next, continue to place a premium on your community. For those of you leaving Portland, build new friendships, embrace your new community, show them what you've got, Maine trackers. No matter where you're headed next, take time to keep in touch. Call your mothers and your fathers, text your Maine track colleagues, give an occasional update to your mentors and coaches. Send a picture, many of you have my cell phone, send a picture of your first night on call. I love those pictures. Sometimes I get these pictures of people who found other tough students. You know, 3 tough students found each other on call in Arizona, and I got a picture of that. It was awesome. And lastly, retain the sense of joy that I have seen you display so often during these past few years. This is a joyful class. I will remember you as a joyful, passionate class. Now it's my pleasure to introduce your class speaker, who I discovered last night was aptly dubbed Mr. Maine. And that's soon to be Dr. Maine, Dr. Austin Stewart. Mr. Maine is really an apt nickname. Austin was born in Bangor, and he has an intimate connection to Portland and Maine Medical Center, where he was treated and cured of a rare pediatric cancer. After spending some of his youth in New Hampshire, Austin returned to Maine for college, graduating from the University of Maine, summa cum laude. But that academic excellence isn't really what defined him. As an undergraduate, he was known for his leadership in his fraternity, still important to him today, and for his engagement in service, which really seems to be a part of Austin's DNA. During medical school, Austin continued to serve and lead. He served your class as a member of the student council, and he was the Katahdin elected representative for all 3 years. He also engaged in community service leadership as the president of KICS, that's our Kids in Chemotherapy and their students, serving as a buddy to a child undergoing chemotherapy at Maine Medical Center, and volunteering for Maine's Make-A-Wish Foundation. Somehow, there seemed to be more than 24 hours in each day for Austin. As you know, he always made time for classmates in need of advice and performed in an outstanding manner during his clerkship, where, as Dina and I noted in his MSPE, Austin has a rare ability to connect with patients and a unique intuition for clinical medicine. Austin's next chapter will begin this July, and of course, he's staying right here at Maine Medical Center for his residency in pediatrics. So without further ado, Austin.
Thank you for those kind words. I think, other accolades I would add to that is the most hours logged in the KLC without shoes and the most bagels panini pressed in 218 in the MedEd campus. But we'll digress on that. Good morning, friends, faculty, family, and the Maine Track class of 2025. Today, we gather to celebrate a title we've spent years working towards, doctor. It's a powerful word, one that carries with it a deep sense of trust, responsibility, and service. But as proud as I am of what that title represents, it's not the only title I'm thinking about today. Long before we wore white coats or embroidered Patagonias, we carried other titles that shaped how we move through the world. We came to this program as athletes, artists, engineers, caregivers, and advocates. Some of us now answer to mom or dad, Camille and Mariah. Some of us earned an MPH, Ian, Sese, Amy, Lizzie, Amanda, Josh. Others identified as researcher or marathoner, Emma, Fern, Brad, Amy, and on some days, Aiden. or simply friend. What made the main track experience so meaningful wasn't that we set those identities aside, is that we brought them with us. We were invited to show up as our whole selves, and in doing so, we created something rare, community rooted in authenticity. Because we didn't just earn the title of doctor in isolation, we grew into it together. Side by side, through late night study sessions and early morning rounds, impromptu sends or well-themed wellness events, crisis texts and debriefs, stress runs, or coffee walks. And in those shared moments, we quietly took on other titles too: teammate, confidant, cheerleader, teacher, family. These roles, while never written on a CV or stitched into a white coat, are often the ones that shaped us the most. They're the reasons we could show up, belong, and thrive from the classroom to the clinic to the OR. This sense of belonging didn't just happen by accident. It happened because we were surrounded by mentors and peers who led with humanity. People who reminded us that clinical excellence doesn't come at the expense of compassion, and that caring for others starts with being known and cared for ourselves. Of course, this journey hasn't always been easy, and medical school isn't for the faint of heart, and it places us squarely within what Teddy Roosevelt called the arena. We've been in that arena, tired, uncertain, often overwhelmed, but always striving, showing up, learning from our missteps, and getting back up again. And in doing so, we didn't just earn a degree, we earned the right to stand here together as physicians. As we look towards what's next, I found myself thinking about one more title. It comes from the poem called The Bridge Builder, and it's one I offer to take with you to the places that you will be from. Here's an excerpt. The builder lifted his old gray head. Good friend, in this path I have come, he said. There followed me, after me today, a youth whose feet must pass this way. This chasm that has been not for me, to that fair-haired youth may pitfall be. He too must cross in the twilight dim. Good friend, I'm building this bridge for him. We didn't get here alone, and now we have the chance and the responsibility to build bridges for those who will follow us, leaving our patients in clinics, ORs, and communities better than we found them. So yes, we leave this program with a new title, but that title doesn't erase the ones that brought us here. It doesn't make us more of who we were, it makes us more of who we've always been. My hope is that for each of us, we continue to carry our titles with pride, not just doctor, but builder, advocate, listener, community member, and friend. To that end, take your memories and traditions, be it trivia nights, run clubs, bike parties, the TAM, or Fun Shirt Fridays, because that has been the foundation of the main track. And that's what will make you not only great physicians, but meaningful ones. It's been an honor, and before I step away and offer my congratulations, my wishes of good luck, and my thanks to the class of 2025, I want to leave you on one final thought. Much of what I've shared here today has been reflective about the meaning we found, the community we've built, and the titles that we will carry forward. But reflection without action is incomplete. When we have the time, the voice, and the privilege, we also have the responsibility to use them. That's why I'm honored to introduce a colleague and a confidant, an advocate with conviction, clarity, and the courage to ask. Please join me in welcoming my classmate, Max, to the stage.
Wow, these lights are quite bright. Thank you, Austin. I'm so happy to be sharing this moment with all of my classmates as we celebrate the last 4 years of medical school. There may be some of you surprised to see me standing before you today. Believe me, none of you are surprised as myself. But I thought it important to use this platform to speak on an issue near many of our hearts. And I am so thankful Austin agrees with the sentiment and has given me this incredible opportunity to speak with you all today. With all deference and respect to the wonderful and many accomplishments my classmates have made over the past 4 years, and they are quite wonderful and there are quite many of them, I wanted to use these next few minutes to talk about something else. In the celebration of today, it is important to remember what a privilege this moment is, and that there are those of us who have not been as fortunate. Indeed, there are some of us who, through no fault of their own, have had such similar opportunities taken away from them. I'm sure by now you've seen the video of Rumesa Ozturk, a PhD student at Tufts, forcefully detained by ICE agents in the streets of Somerville as she is walking home from school. She is being held somewhere in Louisiana. Her Tufts-sponsored visa revoked, all for the apparent crime of writing an op-ed in the school newspaper critical of the university's response to the pro-Palestinian movements on campus. As Tom Hammond, the so-called border czar, calls for collateral arrests, it is one of many in a string of state-sponsored kidnappings to have taken place in the past few months. I need not tell you who they are targeting. Context shouldn't matter, but this is my colleague, my university, my home. I do not think I have the words to describe the feelings of loss, of anger, of betrayal, disgust that video brought up. On some level, it is personal to me. It needn't be. This is someone's friend. It could have been yours. This is someone's sister. It could have been yours. This is someone's daughter. It could have been yours. Taken as she was going to iftar. Taken for the crime of disagreement. Taken because of the color of her skin and the way in which she prays to God. And if we are to think that it could not happen to us, because she does not look like us, or think like us, or pray like us, then we have failed. We'll have failed this country, we'll have failed this Constitution, we will have failed the countless generational sacrifices of those who have come before us to place us here in this moment. Most importantly, we will have failed each other. And even as I say this, I know that these words are not enough. And in the face of institutionalized hatred, my voice feels so small. I ask myself, who am I alone to speak on such things? To act, to care. I know that many of you feel the same. But then again, who are we not to? A great friend of mine once recently reminded me that we can control the things that we can control. Chief among those is our voice. And so we must find the strength to speak up, to say that this is wrong, to say that there is strength and unity, and we are at our best when we extend our hands in friendship, especially towards those who do not look like us, or think like us, or pray like us. We must find the strength to say that we cannot allow our friends, our colleagues, our families to be taken off the streets of our communities. Rumesa should be home. She should not have been detained. She should be free to speak openly and voice her opinion in the defense of her beliefs, whatever those may be. Dr. King once said that the moral arc of this universe is long, but it bends towards justice. Well, I believe it only does so when we find the strength in ourselves and in each other to reach together and bend it in the right direction. By the virtue of our hard work, determination, and to some extent our station, we have been privileged to achieve all that we have achieved. But with that privilege comes the responsibility, even more so, to control the things that we can control, to use our voice, to reach out, to stand where others cannot. Thank you.
I said earlier when we were trying to organize this session that I'd wait to get up till after the standing ovation. I was talking to Austin. I didn't know we were going to have another reason for a standing ovation. That was great. Both of you, thanks for speaking up. And as long as we're going off script, you reminded me, Max, that I got back from a weekend a couple weeks ago where my granddaughter and I, who's 2.5, Olivia, went on our first protest together. I had never been on one. And we went together down the mall in Washington to speak with the Hands Off. And she lives in Canada right now. So we had this hands off, elbows out. That's what they say in Canada. So thanks for speaking up. I'm Doug Sawyer. I'm the local academic dean. I call myself Dean of the North. I'm a cardiologist, and I've had the pleasure of working with a couple of you on clinical services. But I often come to this event wondering why I never met most of you, but I did meet you all once before. And I gave you a homework assignment. And so I used this opportunity to check in on your first homework assignment to see if anybody followed up. I think I talked to Eli about it. I think I talked to Nick about it. So raise your hand if you finished, even if you remember your first homework assignment, which I gave you on the day of McCusick lecture, because Victor McCusick, who founded Genetics of Medicine, the homework assignment was to go look up his good work, get on the online Mendelian Inheritance in Man website, and find, anybody? Find a favorite gene. Find a favorite gene. I mean, everybody should have a favorite gene by the time they're a doctor. Now, you got a couple more weeks if you haven't done it yet. Now, I know, Tristan, you might want to call one of your favorites that you worked in the lab on, so there may be some of you have an advantage in this exercise. So far in doing this job for 6 years, Amy, 6 years, yeah, you're not alone in having failed the first homework assignment. So still have a chance. Okay, so I want to echo Britt's thank you to everybody because you guys got here. You chose to come here, and that's awesome because I think, Austin, to your point of leaving people better than you found them, you've left us better than you found us. And with Max's comments today, I think it even adds to that. So thank you for that. Thank you for choosing us. Thank you for supporting all their long hours and stresses over the last 4 years. And thank you for staying with them as they go on into the next phase of their training. It's a long road ahead, but it's a fun road, as Amy said. So you failed the homework assignment. The one thing I hope for you, though, is that, like Amy said and Britt said, stay curious. So maybe you'll be curious enough to go. Personalized medicine is coming. There are genetic bases of diseases in my world that we end up having to do genetic testing over. So you should, check in on that one. All right. So besides staying curious, I hope you stay humble and kind and really enjoy your careers and stay in touch with us, with each other. I have the pleasure of introducing your chosen speaker. And over the years, the class that graduating selects a speaker to be the celebratory speaker. And we've had country doctors, we've had country OBGYNs, we've had Center for Disease Control director from Maine. And this year, you guys have chosen one of our very favorite neurosurgeons, Jeff Foreman. So how many of you got a chance to work with Dr. Foreman? Great. So we are super thrilled that he has chosen to make Maine where his career is. He trained in Louisville and then University of Vermont before making his way to Maine. And he's really helped build a phenomenal neurosurgery program for the state of Maine that is we are very proud of to be part of. In fact, I don't know if you're going to talk about it, Jeff, but our first neurosurgeons will be trained over the next several years. We're opening up a neurosurgery training program starting next year, thanks to Jeff's success. So it's really a thrill to have Jeff come and speak to you all. And thank you, Jeff.
Hi. Well, let me say, first of all, to Max and Austin, heavy words, heavy stuff, serious stuff, some of that, and it's a tough act to follow. It's a tough thing to follow, but I'm a compartmentalizer, and I'm going to compartmentalize here, and I'm gonna, I was asked to talk for about 30 minutes, and let me just begin by saying congratulations. Really, these are super exciting times. This is just one of the most wonderful experiences for you, for your family. These graduation events from a med school is just incredible. So many congratulations to you, and it's a real honor for me. Really, I'm totally flattered to have been chosen by you. I'm really flattered by it, for real. And actually, I was thinking about Austin. When Austin comes up and speaks, I saw him last night too. As a neuroscience guy, the brain starts working from the minute you come out of the womb. And for some people, it stops the minute you try to public speak. But Austin and I have the same problem. We have a fear of not public speaking. So I'm here to recognizing that it is my 30th anniversary from graduating med school. I don't feel that old, but 30 years ago, I was in these seats, not these seats, but actually I was in Louisville, Kentucky. My, at the time, significant other, wife now, was in my med school class. My brother was in my med school class. My father was in the audience, who's a doctor. My father-in-law who was in the audience was a doctor. So these events are they mean something. They have weight to them, and this is very reminiscent for me of that, and it's personal. This moment for me as well. Um, so you didn't ask a politician to speak, fortunately. Half of you would be protesting or something. You didn't ask a celebrity. I heard that you wanted Patrick Dempsey, Dr. McDreamy, right? A Mainer, right? You didn't get him, right? You didn't get an astronaut. You got a doctor. I'm just a practicing doctor. I'm what you guys are going to be in about 30 minutes. And so I'm going to speak as a doctor. I'm going to speak as a practicing guy, right? And I realized in your last 30 minutes of med school, I should make sure that you've heard a few things, right? That you shouldn't leave med school without somebody trying to explain a few things to you, right? And these are not like Snapple cap kind of things. This is not, the tongue is the fastest healing tissue in the body. It's not that kind of stuff, right? This is, I decided to talk a little bit more based on what I spend time with the students that rotate with me. I teach about the minutia of neurosurgery and medicine and surgical technique, right? And go over anatomy and all these kind of things. But I suspect the reason I'm here is not because of that. It's because I spend time talking about what I sometimes refer to as sort of daily lessons that I give. These ideas that things that have coalesced in my head over 3 decades now. Some of these are kind of life lessons, some kind of practical for being a doctor, some to keep you out of trouble. Some are ethical things, social things. Some I think are important, like what music to listen to in the operating room. For those of you that don't know, we listen to music in the operating room, and your choice of music counts. And music actually, it's been shown to enhance performance, task focus, speed, even quality of some things. So don't be upset by that, the fact that I say we're listening to music in the operating room. But we talk about this. I also talked about some things that are probably stupid, but here we are. So I decided that I have 30 minutes. I was going to try to come up with I came up with 5 things that I thought, things that have coalesced in my head over 3 decades that you could call these kind of like in this I believe sort of thoughts, like how I do it sort of ideas that come down to trying to do this. I think that the idea here is you want to be smart, you want to be a scientist, you want to try to be careful about getting away from cognitive biases. You want to also try to be thoughtful about how you pick your mentors, smart people, and you want to find ways to carry the load of this whole job, being a doctor around. I think some of what I'm going to tell you, probably these are little bombs I'm planting in your brain that one day are going to explode. You're going to be like, oh yeah. I hope some of it resonates today. But this is what I thought I'd go through, is these ideas about, these are things that I try to do. I'm actively doing because I need them. I need them as ways to get through this, to try to be successful at this. This job isn't easy. It's incredible, and it's not easy. And so I'm going to walk through these 5 things and try to help you see the way I see it, the tools I have, the tricks I have to try to do this. So the first one, this idea about staying smart. It sounds stupid to tell people to stay smart, especially smart people, right? Talking to smart people, telling them it's not be smart, it's stay smart. And it sounds obvious, but medicine really relies on you. It requires you to be smart. It requires you to know facts, right? It does. It's not sufficient to just know facts, but it is a necessary thing, right? You have to know how to use the facts. You have to know about statistics, for example. I don't know if you've ever heard the saying that there are lies, there are damn lies, and there are statistics, right? You have to be careful about statistics. You have to be careful about how you interpret data and things, but you need data. You have to be smart, and you guys have chosen your specialties. Today, it's clear the direction you're going. Almost all of you are very clear about this. You've chosen things that you're interested in. Read about them, learn about them, become the expert in them, and the knowledge base turns over time. So one of the message I'll offer you about trying to be smart in this and stay smart is you have to be invested in it. You have to engage in it. You have to, the knowledge base in your specialty is going to turn over. I can tell you in neurosurgery, every 5 to 10 years, if you're not keeping up, within about 5, 10 years, it starts to show. your techniques may be a little antiquated, your thinking may be antiquated, right? I personally, it sounds geeky, but I fall asleep with journals. I read journals while I get dressed in the morning. I love the story of neurosurgery. My wife gets on me for not reading more fiction, but the nonfiction is incredible. I mean, there are characters in these stories. There's history in these stories. I mean, I can read about violence and all sorts of things in neurosurgery journals. And there's plots and conclusions. I love following it. I've enjoyed it for 30 years. I think I really encourage you, stay smart. It's important in this, right? They didn't tell me when I got in med school. I was like, oh, med school, I can do this. 4 more years, I got this. And then it turns out that, at 7 years, I was still taking written tests, and I had an oral board exam 2 years after that. I mean, really, 32 years of being, in school, being actively educated. It's not over yet, though. Stay smart, number one. 2, you want to do this in a scientific way. You want to approach medicine as science. And nobody told me this. It's just what I've come to believe. I think that we're scientists. We in medicine, at the heart of medicine is a fantastic reality that we perpetuate things that are frankly erroneous. Right? These theories that eventually, historically, they sort of fall apart. Right? We're masterful at committing to things that eventually are proven wrong. It's really remarkable. So you have to go into it thinking as a scientist, right? 100 years ago, a lot of the things we were doing, I mean, it was, at the beginning of the 19th century, there were bloodletting for a lot of diseases. I mean, imagine what it's going to look like in 20 years. During your practice career, it's going to change. So go into this as a scientist. Ask questions. There are no wrong questions. They're just wrong answers, right? And I encourage you, when you see patients, practice as a scientist. So patients don't want to hear that we're experimenting on them, right? But the reality is you should think like a scientist. You should go in with a hypothesis. Think I know what's wrong, an educated guess, right? You should design some kind of a study, an intervention that you think is going to work. You should implement that intervention. You should measure the results. You should draw conclusions, circle back around and see if it worked, right? That's science. That's, I think, how we should be caring for patients. That's part of it, right? And this is how we progress. So be a smart person. Go into it scientifically. 3rd, I worry about cognitive bias. We rely a lot on incomplete evidence, right? We develop all sorts of shortcuts, these heuristics we talk about, right? We make a lot of good rational decisions, quick thinking, right? And today, frankly, you're about to shift from using this knowledge to take tests to using it to take care of people, right? And you're going to be motivated not by grades, you're going to be motivated by trying to do the right thing, right? We get motivated by fear of doing the wrong thing, fear of making mistakes is real. Perfectionism motivates some people. I don't think I have that problem. Every time I look in the mirror, I catch a glimpse of myself in the mirror, I realize I'm not a perfectionist. Right? It's fear of making mistakes, and I want to do the right thing. That's why I'm trying to do things. And I'll tell you, a big source for error is cognitive bias. Turns out cognitive bias is the source of more medical errors than failures of lack of knowledge, right? It's subtle, sneaky stuff, right? And I saw myself fail that way. I see failings in medicine related to cognitive bias failings. For those of you that don't know much about cognitive bias comes in a ton of different types. For example, your primary care doc seeing patients during flu season coming in coughing, and every patient you see, you say, oh, it's a cough, it's probably the flu, it's the cough, it's the flu, it's the cough. Well, there's probably one in there, right, in your 1,000 patients that's maybe it's not the flu, right? And so one of a classic cognitive bias would be availability bias. The diagnosis, it's available, it's right there, right? Probably the flu, right? That's called availability bias. We have to be careful about it. There are a whole bunch of other ones, like confirmation bias, the idea that you're confirming a diagnosis sent to you. So I get patients sent to me all the time. They have a pinched nerve in the neck, pain down the arm, and they're sent to me as a cervical radiculopathy. And they come to me, and it's easy to just confirm that, just to roll with it, right? And every so often, it's not that. It's a tumor in the shoulder or something, or some other shoulder problem, right? So that's called confirmation bias. There are all these different biases, and the thing I will offer you, the trick here is you have to put in play, you have to bake into your practice some strategies for debiasing. And I think the most powerful one that I have to offer you is it's taking cognitive pauses. And you've probably heard that language about cognitive pauses. So the idea here is you're rolling along, right? Make some timeouts in it. And a classic one is, I think the two most powerful ones I use are this idea of diagnostic timeouts. So that patient's rolling through and has a cough and it's flu season. I stop and I ask myself, what's the differential diagnosis? It's a cough, right? Could it be heart failure? Could it be pneumonia, right? Could it be something else, cancer, on a tumor, right? So these diagnostic timeouts, right? Another one is worst case scenario practice. So at the end of that, I might say to myself, what's the worst thing that could happen if I'm wrong here, right? It's a cognitive pause. And I think this stuff's, it's super important. Get educated about cognitive bias, try to avoid it, build in debiasing strategies. This stuff is powerful. It's important. Huge source for trouble. The next thing I want to talk about, the fourth thing, so you're a smart person, you're a scientist, you're trying to unbiased, you got to find people that can teach you. You got to find mentors, right? And how do you pick mentors? How do you do it? How do you find a guru? You know, what you're going to see is that healthcare practice, there's a lot of variation, right? Variation doesn't mean there's things being wrong. It's not all right and wrong, right? I do brain surgery. I don't shave heads for my brain surgeries. A lot of people shave heads. Am I wrong? Are they wrong? I don't know. It's just a different way. I have a partner who says there's the right way, there's the wrong way, and there's my way, right? There's a lot of ways to do things, right? You'll see one doctor go in and a patient in heart failure and set a ventilator setting a certain way, and the next room a different doctor taking care of the same kind of problem, setting the ventilator a different way. How do you know who to follow in that, right? Two respected, competent clinicians can do different things, teach you different ways of doing things, right? And it causes some cognitive dissonance in your head and some uncertainty. And so I ask students, I say, well, how are you going to pick a mentor? How are you going to decide who to follow? Should you be following me, or you want to go to the room next door? He does it differently. You want to follow him. How are you going to decide, right? And a lot of students will say, well, I'd follow the one who gets the best results. And I'll say, well, can't you get the best results doing the wrong thing or doing a suboptimal thing anyway? Not the wrong thing, but you do a suboptimal thing. How about placebo? You can get good results with placebo or luck, right? I don't know if following results is really the thing you should prioritize when you're looking at a mentor. And I'll say, well, what else could you do? And they'll say, well, maybe I follow the most experienced provider, or the one who's got the most titles, the chairman. Follow the chairman. I'll do what they say. Well, I would argue that when you've been there for a long time, maybe you've been doing a suboptimal technique for the longest. I don't know, or maybe you're not keeping up. Or if you're the chairman, maybe nobody's challenging the way you're doing it. So, mentors. I will tell you what I've decided along the way. I needed structure for this. I need to structure my assessment of these students, of these mentors, right? As a student, and I still do this, right? In neurosurgery, we have limited data, right? So you walk in a room and there's only so much data driving it, so you get a lot of opinion. Who do you follow? Well, I'm going to give you some guide for it. One is follow the guy who's got the data. You've got to start with that. They should know it. They should show it to you. They should use it, right? Data should dominate practice, right? I think that's key, right? If you're not following the data, if you're going to actively say, well, there's the data, but I'm not going to follow it, frankly, that should be called research, right? That's the way to do that, right? So I would start by that, knowing that the data that we use, it's in peer-reviewed journals, it's big practices of academic people that are thoughtful, that are studying something. That should trump most people's personal experience, right? So I'm going to encourage you, start by asking about the data. If you're seeing some variation in care, tell me about the data that's driving what you're doing, right? I think then you can ask, are you getting better results or as good of results? What happens though when you have two clinicians, they're doing it different in two different rooms, they get same data, same results, just different techniques, different choices, right? I would say, well, who's more efficient? What if one surgeon takes an hour and one takes 2 hours? I guess I'll do it the way the guy takes an hour to do it, right? After that, I might say there are other things to look at. How about is one person do it more cost efficiently, right? And I would say if all that stuff is the same data, same outcomes, same efficiency, same cost, I'd do it with the guy who's having the best time, right? I'd follow the guy who's just doing it easier, enjoying it more, right? The final thing I offer you is a little more weight to it. It's a little bit of a heavier thing, but I think as you go through this, smart, scientific, unbiased, you've chosen teachers. How do you handle sort of the heaviness of the job? I think these jobs are heavy. Healthcare is heavy stuff. It'll break your heart. You're going to see things that you're going to see unspeakable suffering, frankly. And most concerning or disconcerting is some of the harm will be at your hand, despite good intentions. And for surgeons, for technicians, you go in there trying to clip an aneurysm. The aneurysm ruptures. Patients have a stroke, right? That's despite good intentions and training and all that, right? I'll tell you that for medical doctors, you prescribe a medicine, right? You prescribe a blood thinner. Standard things. Just prescribe a blood thinner for somebody with an irregular heart. When they bleed into their brain because of that medicine you gave them, or they have an adverse reaction, or they have a nasty response to a chemotherapy, right? You've got to find ways to deal with that. You've got to find ways to live with it and not end up in your closet or under a bottle, right? And I'll tell you what I've sort of put together. Again, I make this stuff up as I go, but 3 decades of it. Here's where I am in that. For me, it's 3 parts to how I try to minimize this load that I'm taking home. The first thing is I try to commit to an informed decision-making thing. The other language might be shared decision, right? The idea is that patients come in and you walk them through, this is your disease. I'm going to educate you about it. I'm going to help you understand it. I'm going to tell you about the options, the risks, and benefits. And then at the end of that, I'm going to help you. I'm going to help share in making a decision with you. What seems right for you? Another mindset in that is to say, I'm not going to be paternalistic about it, right? So it's non-paternalistic medicine. That's what they want here in the US. We should give it to them. And it helps in this, in carrying the load, is if you've helped somebody walk through their disease and pick a path, right? Even if you know sort of medically what the best path is here, it should still be a shared decision-making event, right? And if you've done that, number 2, you're the right person to do it, right? You're the expert. You understand this. You've trained for it. You know what you're doing, right? If you don't know or you're uncertain, ask for help. Call a partner in and have them join you. Your partner's done more of this than you. Bring them in. Let them help. You need to call a specialist about a disease. Call a nephrologist if it's a kidney problem. Call a pharmacist if it's a drug problem, right? But at the end of it, you've got to be the right one to do it. You've got to be convinced of that you're giving care that you can deliver. And then you've got to do a good job. You've got to do a good job. So imagine if you've done all those things, you're going to, when something bad happens, you'll stomach it a little bit better. You will. Compromise any of that, right? Feel that, if a patient comes back to you and says, man, did I have to do that? Did I really need to take that drug that made me bleed into my brain? You want to be able to look back and say, we talked about it. You were educated about it. You helped choose it. It made sense at the time. Right? And you do all this stuff, and I think you'll have a little easier time when the weight of it all comes down on you. So I think with that, these are the little bombs I'm placing in your brain, right? That at the end of it, you come out, you're smart, you're scientific about it, you're not coming with bias, you picked smart teachers, you found ways to give care in a way that also lets you give care. And so I was thinking about, what do I want for you, right? I heard this thing about, there's a headmaster in Britain who said he wants students that are adequate at a dance and invaluable at a shipwreck, right? And I was thinking, well, as your friend, I want you to be adequate at a dance. But you know what? As a patient potentially, as a teacher, as a coworker, I want you to know what you're doing and invaluable when the ship goes down, right? And so my hope is that all of you really become full-fledged at what you do. And this concept of being full-fledged, an apple tree wants to make apples. That's all it wants to do. It doesn't care about making oranges. It doesn't judge itself next to the orange tree. It's a full-fledged apple tree. Well, your job going forward is to become a full-fledged doctor. That's your job now. Be a full-fledged doctor and treat yourself well doing it. I don't, this job is kind of out of balance. You're going to put too much into it, too much time, too much effort. It's going to compromise your family and your lives, your health to some degree. It will, and that's okay. I think it's okay. I don't think that balance is the answer in this. I know I go against some grain when I say things like that, but this will be out of balance by many people's metrics, right? But the job is an identity thing in part, right? You're a doctor now. That's what you're going to be in a few minutes. You're going to be a doctor. Be a full-fledged doctor. Invest in it. You're going to love it. It's incredible. It's a gift to know about the body. It's a gift to use that knowledge to take care of people. And it's a gift. So I leave you with this final thought. Life is just time and energy. That's all you got. You got time, you got energy, right? This is a great path to spend your time and your energy. It really is. And they say, time flies when you're having fun, right? Well, here I am 30 years into it. It's flown. It's flown. So I feel very lucky, and I hope that you're as lucky as I am. I hope you have a long life, but that it feels really short. So congratulations to all of you. Thank you again for having me.
Thank you so much, Dr. Florman. So I have the pleasure of what we've all been waiting for, which is to introduce the class, the Maine track class of 2025. As I mentioned briefly during match day, you will always be a very special class to me. You're the first class that I worked with in my role as dean here. I got to be your course director for Introduction to Psychiatry and Addiction Medicine. And then I transitioned into this role, and literally the day it was announced, I had a student say, "Can I talk to you?" And I said, "Absolutely, I'm ready. I'm ready for this." And I feel like you're the first class that I think pretty much every single one of you I've connected with, maybe even just briefly on an individual basis. I think one of the highlights for me in working with you was actually yesterday. At the end of Capstone, watching all the photographs flash up and seeing not only the connections that you've made with patients, like I was aware of all of that, but the connections that you have made with one another are just so beautiful. I mean, everything from your first the white coat ceremony with everybody in masks, to your time working hard, to your time hardly working. You're a class of love. I mean, this has got to be a record, right? 4 main track couples. Then we have, I mean, our LIC was literally more than half couples. We have a main track Boston couple. We have a main track Quinnipiac couple. We have a main tracker who's married to a former main tracker. We have 2. I got to see all of your photographs of your weddings that have happened, here as, with other people too. And just the connections that you have with one another and those relationships, I think are what really make the main track so special. You have this greater class of Tufts. You are a graduate of the Tufts University School of Medicine, and that's a big class of 200 people. And those folks are absolutely your colleagues. You guys are more than that. And those relationships are really going to last. And so it's just been a beautiful thing to watch. As was demonstrated here today, and thank you, Max, and thank you, Austin, you are a class of advocates. You're a class that is, as Dean Kulik said, dedicated to your community. You are not afraid to speak up against injustice, even when it makes people uncomfortable. I found myself feeling a little uncomfortable. And I said, you know what? Good. As a psychiatrist, I never use the word should. For those that know about cognitive behavioral therapy, should is a word we don't use. We should be uncomfortable, right? You are so special. And you are both physicians and human beings, as Austin said, that have all these other titles and all these other backgrounds. I know I've thrown a lot of ands at you over the years, right? You know I love the word and, not but. You should replace, every time you say the word but, replace it with and, right? I've said a lot of those, and I'm going to say a few more. You are physicians, and you are human beings and people with opinions and ideas, and you should keep sharing them. You are entering a profession that's going to pull you away from other priorities at times. There's gonna be times that you're gonna have to tell your family, sorry, I can't be there today. And you can still prioritize your family first. That it doesn't mean that you're choosing one over the other, it's both. You have all worked incredibly hard to get here, and you deserve to be here. And you have privilege, and you need to remember you have this privilege. Some of you, maybe backgrounds might be different, maybe some more than others, but if nothing else, you were born with the privilege of an incredible mind that got you here, and you need to remember that because you're gonna have a lot of power. Life is really gray. Even the most black and white specialties, and we all have the urge to be black and white at times when we're feeling anxious. Life is gray, and those of us that try to live in black and white are going to be unhappy, and they're not going to be successful. Please, if you can remember just one thing from me, it's replace the word but with and. You are loved here in Maine, and you are going to be so missed. And for those of you leaving, you're ready. And I am very confident that you're gonna do awesome things. So thank you all so much for including me in your journey. So with that, I invite you to come on up one at a time. We're gonna give you a pin and congratulate you individually. Come on up.
Elijah Babcock. Isabella Bennett. Michael Bennett. Kayla Bronzo. Cece Bush. Fern Calkins. Call. Jennifer Coates. Nicholas Donaldson. Amy Eklund. Zachary Gauthier. Catherine Janelius. Julia Greenwald. Nicholas Haas. Tyler Hinckley. Alexandra Jensen. Camille Lubetkin. Amanda Massey. Dana McCarney. Tristan Merrifield. Mariah Malazzo. Anne Mullen. Rory O'Connell. Beanie O'Shea. Joshua Parbs. Aiden Pete. Carrie Quigley. Ian Roy. Anna Saucier. Maxwell Seneschal. Amy Schoberg. Hannah Slattery. Emma Stevens. Austin Stewart. Peter Tao. Emily Thunberg. Elizabeth Vinton. Doug Wary. Annika Williams.
Great. That concludes our formal program. Thank you all so much for being here. We really appreciate it, and we're all incredibly proud of you. Congratulations, Maine Track. Sorry. Woo-hoo! If our students could all please come onto the stage for one last photograph. And then afterwards, please join us for a reception in the hallway. Feel free to go on out. Thank you.